calcium and sodium, potassium is a mineral that's found in some foods. Having the right amount of potassium in the diet helps to keep one healthy, so it's crucial to eat plenty of potassium-rich foods. Many of the foods that you already eat contains potassium. If one needs to boost the amount of potassium in the diet, making healthy food choices is crucial. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to discuss about how potassium-rich food helps to improve women's health. Women who ate bananas, avocados and salmon could reduce the negative effects of salt in the diet, according to a study published in European Heart Journal, a journal of the European Society of Cardiology. The study found that potassium-rich diets were associated with lower blood pressure, particularly in women with high salt intake. The study included 24,963 participants, 11,267 men and 13,696 women of the EPIC-Norfolk study, which recruited 40 to 79-year-olds from general practices in Norfolk, UK between 1993 and 1997. The average age was 59 years for men and 58 years for women. Participants completed a questionnaire on lifestyle habits, blood pressure was measured, and a urine sample was collected. Urinary sodium and potassium were used to estimate dietary intake. Participants were divided into tertiles according to sodium intake, that is low, medium, high, and potassium intake, that is low, medium, high again. A total of 13,596 participants were hospitalized or died due to cardiovascular disease. The researchers analyzed the association between potassium intake and cardiovascular events after adjusting for age, sex, body mass index, sodium intake, use of lipid-lowering drugs, smoking, alcohol intake, diabetes, and prior heart attack or stroke. In the overall cohort, people in the highest tertile of potassium intake had a 13% lower risk of cardiovascular events compared to those in the lowest tertile. When men and women were analyzed separately, the corresponding risk reductions were 7% and 11% respectively. The amount of salt in the diet did not influence the relationship between potassium and cardiovascular events in men or women. The results suggest that potassium helps preserve heart health, but that women benefit more than men. The relationship between potassium and cardiovascular events was the same regardless of salt intake, suggesting that potassium has other ways of protecting the heart on top of increasing sodium excretion, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.